Hi everyone, welcome back to my YouTube channel 𝗥𝗲𝗃𝗲𝗿. Are you guys excited about the June month question paper? Well, get ready. I'm going to uploading the full question paper for you all. So make sure you watch till the end. Stay subscribed and let's get into it. So let's start our video. Okay, so let's start. First of all, let us discuss about the anatomy and medical terminology session questions. So the first question is, it is related to a bone, okay, infraspinatus bone. And the second question is related to the lymphatic system, okay, appendix, spleen, axillary, lymph nodes, lymphatic system related question are there. And the third question is about the vein, okay, femoropopliteal vein. Okay, it's a most repeated question. And also the fourth question is a repeated one, laparotomy. Okay, laparotomy. And the fifth question is skin outer layer. Okay, skin outer layer. I think it's a new question. Okay, so in our previous question paper, this question are not seen. Okay, so it's a new question. So please highlight the fifth question. Sixth one is it is related to kidney. Okay, kidney related question. Nephro means kidney. Okay, neuro means nerve. Okay, so yeah, this is about in the anatomy and medical terminology session. And let us move on to the complaints and regulatory session. So in complaints, the first question is about 70 modifier. Okay, urgent care modifier. And second question is Medicare Part B. So you have to study all part. Okay, Part A, Part B, Part C, Part D, Medicare. Okay, what are the rules? What are the basic definition based on the Part A, Medicare, Part B, Medicare, Part C, Part D. Okay, so in June month question paper, in complaincy section, second question is about the Medicare Part B. Okay, let me check on the coding guidelines session. So next is coding guidelines. Here are 5 questions are asked. So the first question is quick look. Okay, 76815. The code is for quick look. So you have to check this code in your CPT textbook. Okay, under 70K. Okay, 7K series. 70K series. Okay. Yeah, and the second question, coding guidelines, second question is about the modifier 78. So you have to study about the basic modifiers, modifier 25, modifier 50, modifier 78. Okay, main modifiers. So the third question is about NOS, okay, not otherwise specified, NOS. Fourth one is brackets. Okay, brackets, what is the use of brackets? Brackets is used to as a synonyms or alternative wording. Okay, and the fifth question is 𝗵𝗽𝗲𝗍 coding guideline. Okay, so in your question paper there is a coding guideline are there, so you have to check the guideline and take the appropriate code for that guideline. Okay, so here 𝗵𝗽𝗲𝗍 is the code, right code. Okay, and let us move on to the ICT session. There are 4 questions. Okay, the first question is M17.31, B20. Okay, so B20 is always based on HIV. Okay, you know, human immunodeficiency virus, B20. Okay, so here is our first chapter. And second question is about I20.0 myocardial infarction. Third question is about 𝗤𝗂𝗃. Okay, 𝗤𝗂𝗃 means you know, it's a pregnancy, childbirth and puerperium chapter. Okay, chapter 15th questions. Okay, chapter 15th codes are 𝗤𝗂𝗃. So here 𝗤𝗂𝗃 is triplets, 2 normal deliveries, 1 C-section. Okay, and the fourth one is eye related question. The code is E10.319. Okay, E10.319. Okay, so here are the 4 ICD important questions in our June month. Let me check CPT code sections. So here the first series is 10K series. There are 5 questions are there. The first one is, it is based on I and D of abscess. The code is 10060. And the second question is, the question contains 3 codes. 11041, 11047, 11042. So you have to check in your CPT textbook about the definitions of these three codes. Okay. And the third question is punch biopsy related. So I think it's a most repeated question. Punch biopsy. Biopsy related questions are most repeated in every month. So please note it down. The code is 11104 and 11105. Okay. And let me check the fourth question. Shaving of epidermal. Shaving of epidermal means the code is 11300. Okay. 11300. And the last question in 10K series, I mean fifth question is destruction code related question 17110. So here are the June month 10K series question. Then let me check the 20K series sessions. Okay, the first question is trigger point injection 20552. It means in our questions they are asking about two muscles. Okay, that is why 20552 the code. Okay, the trigger point injection. And the second question is removal and replacement of stent. Okay, removal and also replacement done. Okay, of stent. Okay, so the code is 20697. And the third question is proximal humerus prosthetic. The code range is 23616. Yeah, the fourth question is medial manisectomy. Medial manisectomy code is 29881. Also important and also repeated. Okay, yes, let me move on to the fifth question. Open treatment of distal tibiofibular. The code is 27829. Next is the DK series. The first question is about nasal endoscopy. The code range is 31276. And let me check the second question. It is about lobectomy. The code is 32663. Third question is about pericardiectomy. Pericardiectomy, the code range is 33030. And the fourth question is removal of cardiac rhythm monitor. Okay, cardiac rhythm monitor 33286 is the code. Okay, so here are the 30K series question in June month. Next is 40K series. Here 5 questions are there. The first question is biopsy related question. Okay, biopsy of salivary gland. The code range is 42400. And the second question is adenoidectomy secondary. So 42835. I am just telling the code and also the main definition. Okay, you have to check in your CPT textbook. Okay, balloon dilation. Third question, balloon dilation. The code is 43220 and 43201. Fourth question is colectomy partial. Okay, colectomy partial. So in this session you have to notice one thing. Total or partial colectomy. Here the fourth question is about partial colectomy. Okay, so the code is 44206. Okay, otherwise in our question colectomy total they were asking, the code will changed. Okay, so here partial code is here colectomy partial, so 44206. And the fifth question is not ruptured appendix. Okay, not ruptured appendix. The code range is 44950. And the next is 50K series questions. 50K series, there are 6 questions are there. So the first question is non-clamp circumcision. The code is 54160. And the second question is removal and replacement of non-infected. Okay, removal and replacement of non-infected. The code is 54416. Third question is biopsy prostate. Biopsy prostate. The code is 55700. Fourth question is vulvectomy 56630. Fifth question is insertion of IUD. Okay, insertion of IUD 58300. Sixth question is about delivery vaginal. Okay, routine care delivery vaginal. So the code range is 59610. Okay, so please note it down, all the questions. Okay. Okay, I will upload the part 2 video soon. So thanks for watching.